Hey, Dr. Gene here with Monadnock Natural Health, where we're helping you to find your blueprint to wellness. Today I'm going to talk about the top 5 reasons why our healthcare system is broken. If you look around, if you look at statistics, we spend $4.2 trillion a year on healthcare. 90% of it is spent on chronic health conditions, and they don't get better. They just keep treating those conditions. We spend more, double than the next closest country on healthcare, yet we are the lowest. We're last on health outcomes among industrialized nations. 50% of our children now have a chronic illness. It's shameful. So what's the problem here? The first one is, the most basic thing is that the system is focused on minimizing and suppressing symptoms, not getting to the root cause of why those symptoms happen. So you have something going on, typically you take a pharmaceutical, it reduces the symptom, takes away the pain, the headache, lowers the blood pressure, whatever it may be, but it doesn't fix the reason why we got there. And so if you stop taking that medication, the blood pressure comes up, the pain comes back, the inflammation, whatever it is trying to treat. So it's a never-ending cycle of continually taking medications to suppress symptoms but never increasing health, and there's a price to pay for that. The second reason is lack of individualized attention. In this country, the average visit time to our medical doctor is 7 minutes. And 7 minutes is not enough time to get to the root of what's going on, to really figure things out with the patient. And so there's just about enough time to look at a lab test and say, oh, here's your medication, we're going to write you a script. And so nothing's changing, and we keep minimizing symptoms because the doctors don't have time based on the system to really get into depth and really help people. The third reason is that, again, the system is basically focused on pharmaceuticals. Every problem, there's a pharmaceutical drug to manage that or suppress that symptom. And drugs have side effects. Eli Lilly, way back when, there is no drug without a side effect. And when you see these commercials about these medications and what they're designed to treat and then the side effects that go along with them, it's crazy because you get more bad than you get good. And it starts out with one medication, blood pressure, and then it's cholesterol, and then it's Prilosec or omeprazole for acid reflux, and then it's something for our blood sugar, and levothyroxine. It just adds up. And the average 65-year-old in this country is on 14 plus medications in a given year. So that's a problem. The fourth reason is that, again, in the system, we're brought up not to take personal responsibility for ourselves. We go to the doctor tells us to do whatever. In my 30 years of practice, I can't tell you how many times I've heard somebody say, well, my doctor said I could or couldn't do this. The doctor's in charge. And that's great if we don't want to take responsibility for ourselves. It's easier to put somebody else in charge, but it's not really working. We need to start to understand what's going on, become involved in the process, see what we're doing in life that may be leading to these problems, and get to real solutions. So that takes some personal responsibility. And the last thing I want to mention is that the system is profit-driven, and the amount, $4.2 trillion, it's all going towards managing symptoms, right? So healthcare is the largest and the fastest growing industry that there is, faster than even tech. And so that means the more people that get sick and stay on medications, the more the industry grows. And it's continuing to grow by leaps and bounds. But it's not really getting to the root of why things are going on, and it just perpetuates the problem. So a system that's incentivized for more sick people because the industry does better is not a system that's going to help us get better. Okay? So hope you all enjoyed that. If you did, please subscribe to our channel. I'm Dr. Gene Clerkin, Monadnock Natural Health, helping you with your blueprint to wellness.